Dr. Walke, during a recent COVID Select Committee hearing, Dr. Fauci attributed the 6-foot social distancing rule entirely to the CDC. 4 years later, it is still unclear who at the agency created that guidance. What process for development was like and how it was intended to evolve with new information? Did the CDC ever revisit and reassess the 6-foot recommendation, and do you all still stand behind it?
Yeah, thank you for the question. During COVID, we used a number of different strategies to try to prevent transmission, including testing, including ventilation, distancing, for example, and masking, of course, during that time. So we had some early flu data, for example, that showed the effectiveness of distancing. The actual scientific studies that would undermine that, I'd have to get back to you with those scientific studies.
All right, I would appreciate if you would do that. Dr. Jernigan, I'm switching to bird flu. Does the CDC think that bird flu or avian flu is likely to become a human pandemic? You're going to defer?
Well, it's in Dr. Daskalowski's
All right.
center.
Thank you for that question. So CDC surveillance systems are key in being able to track seasonal influenza as well as novel influenza strains that we watch closely for the potential for any change that would make us more concerned for human spread. We currently assess the risk to the general population to be low, but have ongoing concerns for people who have exposures, like those who are working with animals with known infection. We monitor infections, transmissions to humans, and the way the virus is evolving specifically to make sure that we don't see anything that makes us more concerned. Highly pathogenic avian influenza is a virus that we've been tracking, or H5N1, for 20 years and have had a high level of concern monitoring it very closely. And so our surveillance systems, the way they're overlapping, both our general surveillance system as well as the specific work that's happening with farm workers, is really around the fact that we always have a level of concern that a novel flu could change and that it could potentially result in more efficient human transmission.
So translating that into English,
Certainly.
for the folks back home.
Yeah.
Maybe we don't think so, but we're keeping an eye on it.
We're watching it. So
There you go.
Bottom line is that our main goal is to keep our fingers on the pulse.
Now, let me go to my next line of questions, since I've got the expert now. A recent New York Times article reported that only about 60 people have been tested for avian flu, while over 157 herds in 13 states have been infected with this particular virus. Here's my concern. We're not testing asymptomatic people. I know that a lot of the farmers are concerned that people will think, oh my gosh, this is a horrible thing. But I think if we get more information and more data points now, we may find that there's a lot of people who are getting the virus, they're asymptomatic, and studying the DNA of those people who are asymptomatic or have such mild cases that they aren't necessarily showing up in a doctor's office and getting tested would give us more data. Should there be a mutation later that makes it more deadly or more contagious for humans, and we're not doing anything, as I understand it, am I correct in that we're not looking for asymptomatic people who may work with the same herds that somebody who's gotten sick with? If they're not reporting symptoms, we're not testing them, right?
Thanks for that question.
Yeah.
Actually, we have just released data around a study looking at individuals who are working closely with dairy cows in Michigan. So special thanks to Michigan Department of Health for the great collaboration. What we did there is we surveyed those individuals, learned what their exposures were on the farm, but then also drew blood to look for evidence of exposure to avian influenza in their blood. We tested 35 people in that situation, and none of them demonstrated evidence of avian influenza infection, really supporting the plan of testing individuals with symptoms. I'll also add our influenza systems that we have for seasonal flu have actually tested 32,000 people since March using an algorithm that would detect H5N1 in the general population. So we have this targeted testing based on exposure, and then this sort of seasonal surveillance that also looks for these
in the seasonal surveillance,
Yes.
Are you seeing any upticks in particular regions?
Great question. So we have a lot of overlapping systems. We look at syndromic surveillance, so what's happening in the emergency departments. We look at percent positivity of testing, and looking across those, we see nothing that is a signal beyond what we would expect this time of year.
And the reason that I ask is because I'm particularly focused on the avian flu. We had that one death, I believe, in Mexico. And I'm just trying to make sure that we're not seeing, like we did with COVID, that there's a regional variation that suddenly explodes, and the more we can do, the better. Sounds like you're working on it, and I appreciate that, and I yield back, Mr. Chairman.
Thank you.